everyone. Welcome to another session of VOH's initiative, 4th edition of National Cancer Conclave, Uniting for Closing the Care Gap, supported by AstraZeneca. I, Dr. Ruchka Gambhir, your host for the evening, would like to welcome our esteemed guest speaker, Dr. Jyoti Wadhwa, for today's session on empowering awareness, understanding, and preventing endometrial cancers. Dr. Jyoti is currently the Vice Chairperson and Head of the Department of Medical Oncology and Hematology at Paras Health, Gurugram. Thank you so much, Dr. Jyoti, for taking out time of your busy schedule and joining us today.
Thank you, Dr. Ruchika, and thank you, VOH. Thank you.
So, Dr. Jyoti, before we get into the deeper discussions on the endometrial cancer, we would like to begin by understanding what is endometrial cancer and how is it different from uterine cancer. Also, at the same time, we would like to understand what is the current prevalence of endometrial cancer in India.
All right. So, uterine cancer means that cancer is arising from a body part called uterus or the womb, right? So, there are actually two types of uterine cancer. One is called endometrial cancer, which arises from the lining of the uterus, the endometrium. And the other type is uterine sarcoma, that arises from the muscle in the wall of the uterus. So these are the two types of uterine cancer. Endometrial cancer, however, is the more common subtype of the two. Now, endometrial cancer is a very common cause, in fact, the most common cause of the postmenopausal bleeding. So, if a lady who has attained menopause and then even notices spotting and not even frank bleeding must visit a doctor and get herself evaluated, because this postmenopausal bleeding could be an indicator of endometrial cancer. So, do not ever neglect this symptom. Endometrial cancer is one of the common cancers affecting the women's the reproductive organs. And with the increase in the prevalence of obesity and the changing lifestyles, the incidence and prevalence of endometrial cancer is in fact rising in India as well. So one needs to be very much aware, and I'm very happy that VOH has taken up this initiative to raise awareness about endometrial cancer.
So, ma'am, in continuation to the previous question, can you please provide us some insights on how many patients on daily basis you see or encounter who come to you at the stage 3 or 4 of endometrial cancer?
So, unfortunately, most of the patients that reach us are already in advanced stages. So, I would say two-thirds of the patients are already in stage 3 or 4. However, we do see patients in early stages as well. And the other thing is that the most common gynecologic cancer continues to be cervical cancer, right? Which is very much preventable, very much early detectable, and also there is presence of an effective vaccine against cervical cancer. Now, subsequent to cervical cancer, in terms of numbers, we see both ovarian cancer and endometrial cancer. But
Okay.
unlike cervical cancer, wherein there is a very much lag period, wherein it gives us an opportunity for early detection through pap smears and HPV testing, endometrial cancer, unfortunately, is not marked by that long a lag phase. So, therefore, it's very important to immediately report the symptoms. As I mentioned, that the symptoms can be sometimes bleeding or sometimes very non-specific symptoms. So, must consult a gynecologist or an oncologist if you have any of those warning symptoms that could be suggestive of endometrial cancer. But unfortunately, most of our patients are in advanced stages. But very effective treatment is available in early stages, wherein a very effective surgery followed by either radiotherapy or sometimes chemotherapy in high risk cases could be very much curative.
Ma'am, as we are already talking about the signs and symptoms, and you have already explained the how postmenopausal spotting can also be used as a symptom. Can you please elaborate a bit more on what other early signs and symptoms the patient can notice himself or herself, and which could lead which could lead her to the gynecologist, and the doctor finally recommends it to the oncologist?
So, postmenopausal bleeding or any abnormal bleeding is, in fact, the most common presentation. But it could also happen in the premenopausal, like before a woman has attained menopause. Even then, any abnormal bleeding, menorrhagia as we call it, any prolonged bleeding or very heavy periods, passing of clots, could suggest endometrial hyperplasia, which needs to be investigated. So, a finding of, say, increase in the thickness of the endometrial lining with a simple ultrasound could be the initial step which could stimulate the or motivate the patient to undergo further evaluation. So that itself is alarming. The increase in endometrial thickness beyond 10 millimeters is also something which needs to be, looked at. So must visit a gynecologist if somebody is found to have heavy periods, and then on ultrasound is found to have increase in the thickness of the endometrial lining.
Okay, that's quite insightful, and I hope people really take care of this thing now. That we know that how even the heavy bleeding can actually be a cause of endometrial cancer, maybe the sign. So before we move on, I would like to understand what are the most common causes or the risk factors which are associated with the endometrial cancer.
So many factors have been found to be associated with increase in the risk of developing endometrial cancer. Some of them have been conclusively proven. However, some are still controversial. So I'll first talk about the risk factors which are definitely known to increase the risk of endometrial cancer. So the top in that list would be the hereditary factors. Sometimes we see patients with family history of having a close relative with endometrial or even colorectal cancers, and they could be carrying some faulty gene which predisposes them to increased risk of endometrial cancer. The other very important factor associated with high risk of endometrial cancer is if somebody is taking, say, estrogen hormone after menopause as a part of hormone replacement therapy. Intake of pills such as birth control pills or tamoxifen, which is a very commonly used drug for treatment of breast cancer. The increasing number of ovulation or menstrual cycles, certain ovarian tumors, and even polycystic ovarian disease is known to increase the risk of endometrial cancer. Another very common and important factor associated with increased risk is obesity. Also, to keep in mind, if somebody has had breast or ovarian cancer in the past, or somebody has atypical endometrial hyperplasia, these people are also at increased risk for endometrial cancer. Now, there are certain risk factors which are uncertain. So, like diet, which is high in fat, or even type 2 of diabetes is known to be linked to endometrial cancer. There are some studies which say that even if somebody has received pelvic radiotherapy at an early age due to some illness, then the risk of endometrial cancer could be high. So it's very important to be aware of these risk factors so that one could undergo appropriate tests at the right time.
Ma'am, you just mentioned that people who are taking the estrogen post-menopausal. May I please know that what are the reasons people may be kind of taking up the estrogen after the menopause?
So sometimes, the menopausal symptoms could be very distressing. And they could be related to, say, with extreme vaginal dryness and the mood swings, the bone health issues, the cardiac issues. So for these are usually these are the very common ill effects of menopause, right? So, and women often resort to hormone replacement therapy, which unfortunately, if contains estrogen and is taken for prolonged periods, has been found to be linked to increased risk of endometrial cancer.
Okay. Now, when we have already taken a bit briefing about what endometrial cancer is, what are the risk factors, the signs and symptoms, I would like to go a bit deeper into these sections and understand about the biomarkers which are being used. So, my question would be why biomarkers testing is important? What kind of biomarkers do we usually test for the endometrial cancer? And when do we test the biomarkers?
So it's very important to know now that we are now practicing modern medicine, or in fact, we are practicing precision medicine or precision oncology. So each patient has a different, even though the patients may be labeled as having endometrial cancer, but all of these patients are not alike. At the tumor level, at the molecular level, they are known to be different. We call this tumor heterogeneity, right? And it's very important to look for the specific biomarkers which could help in decision making. So even in early stage of endometrial cancer, it's very important now to do some specific biomarker testing. So,
Okay.
besides knowing, say, the histological subtype, whether it's endometrioid or serous or some other type, we also need to know the grade, whether it's grade 1, 2, 3. We also need to know the depth of invasion. So, for many years, we were resorting only to these three uh, informations on the pathology report. But now the times have changed. And even for early stage, even for, say, stage 1, it's very important to know the molecular subtype of endometrial cancer. So, just to tell you in brief, that based on the molecular markers, there are four molecular subtypes of endometrial cancer. So, we look for something called pole mutation. We also look for P53 mutation. We also look for the MMR status, whether it's deficient or proficient. And the fourth type is non-specific molecular subtype. So it's very important to know even in early stage and then decide whether the patient now needs something beyond surgery, whether the need is only for radiotherapy, or does the patient even in early stage needs chemotherapy. So that's the beauty of biomarker testing. And obviously in advanced stage, we would do something called HER2 new test, and there is emerging role of even comprehensive genomic profiling in endometrial cancer. So these are some of the biomarkers that have emerged very relevant and important in endometrial cancer.
Okay, so moving on, that was actually quite insightful. I hope it really helps people out there to understand what biomarkers are basically. So moving on, I would really like to know that what is the advanced treatment pathway which we are using nowadays for the advanced endometrial cancer.
Okay, so I would first say that even though the disease may not be so-called advanced stage 3 or 4, even in early stage, as I was mentioning, there could be some high risk category. And it's very important to identify that high risk subset within early stage based on the molecular biomarkers to see whether the early stage also could benefit from addition of chemotherapy. So that's one part. And obviously, when the stage is advanced, say metastatic stage, stage 4, then we have a lot of treatment options. So chemotherapy is very often recommended for such patients, and we have standard chemotherapy drugs which have been found to continue to be effective, like paclitaxel and platinums. Then there is a specific so-called subset of patients within endometrial carcinoma group, which are so-called lower risk, which could benefit just by endocrine or hormonal therapy. So there's a role for that also in a specific subset of these patients. Now, beyond chemotherapy, we have targeted therapy, as I was mentioning that we do test for some biomarkers. We test for HER2 new test. We look for the MSI or MMR status of these tumors. And then we plan whether the patient is eligible for any targeted therapy or immunotherapy. So this is called biomarker driven therapy, which plays a very important role in endometrial cancer. So suppose if the patient has HER2 new positive tumor, we would add HER2 targeted therapy to the chemotherapy backbone. If the patient has, say, deficient MMR status, or the MSI is high, we would add immunotherapy to the chemotherapy backbone. So these are some of the advances which have happened of late. And based on these biomarkers, we decide, whether the patient is a candidate just for chemotherapy or addition of some targeted therapies or immunotherapy. So a lot of advances have happened in endometrial cancer.
And we do understand that these chemotherapies and radiotherapies, these all come with the side effects. And we would really like to understand a bit more about these side effects, as well as you mentioned about immunotherapies and the biomarker targeted therapies. Are there any kind of specific complications or side effects associated with these kind of therapies, or are they those the general which are seen in chemotherapies?
So these treatments obviously come with some side effects, and these treatments are approved because the benefits far outweigh the risks associated. Right? That's very important to understand. Chemotherapy drugs have some common side effects, like the drugs that we use for endometrial cancer. They are known to cause nausea, vomiting, which is 100% preventable with very effective drugs that we have. Then there would be hair loss, which is reversible. Chemotherapy obviously lowers the body's immunity, and therefore there is increased risk of infections. And there could be fall in the blood counts, the hemoglobin, platelet counts, they could fall. So we monitor the patients for all these tests. There could be kidney dysfunction, liver dysfunction, but we start with good parameters and we keep checking before each cycle of chemotherapy. Then the targeted therapies that we often use, say HER2 directed therapy, can be cardiotoxic. So we do the heart check beforehand and we do it at frequent periodic intervals. The immunotherapy is a beautiful way, the newer form of treatment of cancer, which works on the principle of unlocking body's own immune system to go and then attack the cancer cells. So a very beautiful concept, found to be very effective in many cancers, including endometrial carcinoma. And sometimes it can have its own side effects when the immune system starts working against our own or self antigens. But overall, immunotherapy is found to be safer and less toxic compared to chemotherapy. But we have to select our patients very carefully. So the drugs have their side effects, but obviously we as oncologists are very much aware and alert, and we keep looking for them so that our patients can have a good quality of life also.
Ma'am, you also mentioned that people do develop the self antigens. I guess that is what your word you used, in which the body antigens fights against its own body. In that case, how do you kind of cope up with that scenario?
No, what I said was that the immunotherapy drugs sometimes can work against our own self antigens, which are not
Okay,
foreign, right? So, cancer cells are foreign, and these
okay,
immune cells are supposed to go and attack the cancer cells only, right? But
yes.
sometimes they can, in put simply, they could get confused and they may start working against our own self antigens, right? And that's why there could be some effect on, say, skin. There could be skin rash, there could be loose motions, there could be effect on the thyroid gland, there could be effect on the liver. We have to be alert. So we as oncologists are very much careful and we keep monitoring the patients at periodic intervals for these different organ functions, right?
Thank you so much, Dr. Jyoti, for clarifying that for my own understanding, as well as I guess the public who is listening to us. Uh, I would like to know further that are there, like you have told me so much about the immunotherapy and what all advances has been taken. Are there still some unmet gaps in these therapies or in the treatment pathways?
Yeah, definitely. A lot of research is, in fact, still ongoing in terms of identification of newer effective molecules. And there have been some, this immunotherapy itself has found its place, like many other cancers, in endometrial cancer also. And now there are studies ongoing. And in fact, very recently, just last year, there was another study which is looking at the combination of chemotherapy and immunotherapy, and then immunotherapy maintenance. Normally, what we do, we give chemotherapy and all these anti cancer treatments just for a while, and then we stop. and then we wait for it to start progressing again after some time, and then intervene. But now there is increasing role of so-called maintenance therapy, even in endometrial cancer, like so many other cancers. And this is aimed to increase the progression-free survival, right? And obviously ultimately
Okay.
increase the overall lifespan of these patients. So there have been advances. There is increasing role uh, being recognized for newer class of drugs, like we have newer molecules, lenvatinib. We have even PARP inhibitors, olaparib, which is being combined to the chemoimmunotherapy combination. So a lot of research happening. The research is also ongoing to identify the and refine the molecular subtypes further, right? The recently, just 2023 itself, the refinements have happened in the FIGO staging itself. As I mentioned, even in early stage, when we look for those molecular markers, with the identification of some of these markers, the patient could be upstaged also. Say somebody has P53 alteration, so such a patient is likely to have bad outcome, and therefore the
Okay.
patient gets upstaged even though it may be just T1A disease, right? So then we
Okay.
think of adding chemotherapy to such a patient even though the patient is in early stage. So a lot of refinements happening with active research.
Got it. That was actually quite insightful and interesting to know actually. While we are already on it, and there are some, I believe that every disease comes with its preventive measures, and I guess that's what we all believe, that prevention is better than cure, and everything comes with a preventive mechanism. So we would like to know from your end, what preventive measures would you like to advise to our viewers to keep themselves safe from endometrial cancers?
Right. Very good question. And I would say the most important question, because as you yourself rightly said, prevention is always better than cure, isn't it? So, for
Yes.
endometrial cancer, also, there are, in fact, a few things that one could do to reduce the risk of developing endometrial cancer. So, if I have to put it in easier terms, we know that there would be some patients who would be at very high risk. As I mentioned, there are some hereditary syndromes, say Lynch syndrome, or patients with polycystic ovarian disease, or people with obesity who are at definitely high risk. So, and there would be other people who would be at average risk, right?
Okay.
So, let me first talk about the preventive measures which are applicable to patients, people at highest risk. So, somebody,
Okay.
say, has hereditary syndrome, say Lynch syndrome, as we call it. So, the prevention in such a person would include chemo prevention, or prevention with use of pills, oral contraceptive pills, right? And
Okay.
they are very effective in reducing the risk of endometrial cancer by 50 to 60%. And in
Okay.
such people, when childbearing is complete, risk reducing removal of the uterus, hysterectomy is recommended. Now, in
Okay.
those people who have polycystic ovarian disease, combined estrogen progesterone oral contraceptive would be a very effective preventive strategy for endometrial cancer protection, right? Now, coming to those who have obesity, those who have very high BMI, in such people, to reduce the risk of endometrial cancer, weight reduction through dietary modifications and physical activity is recommended. And sometimes, if they are, say, morbidly obese and diet and physical activity are ineffective, then even bariatric surgery could be considered for treatment of obesity and reducing the risk of endometrial cancer. Now, coming to the patients or people at average risk of endometrial cancer, now these subset also should engage in regular physical activity, should eat healthy diet to maintain a normal weight or normal body mass index, as we call it. The breastfeeding also is protective, and one could use the contraceptives, the hormonal ones, to reduce the risk of endometrial cancer. So I would say that lifestyle modifications overall do have a great role to play in endometrial cancer prevention. And research is going in terms of looking at other strategies also for chemo prevention. Drugs like aspirin, metformin, they are also being looked at, but their efficacy is not yet proven.
Okay. Got it, ma'am. That was actually something which I guess which was needed by the population to be heard. You yourself mentioned that people with PCOD are at higher risks. So, is there anything which you would request, you would actually kind of recommend to them to take care of? Since now we know that PCOD is no longer a disease which is just affecting a particular age group. It has been seen from 13 years to I guess 65 years or 45 years, what the till the date when the people actually kind of girls actually go with the menopause. So, is there any special kind of the preventive measures you would request or recommend, or something which every girl should actually take care of to prevent herself from the
So
PCOD
most
as well as of cancer?
So these people, obviously they would consult their gynecologist, who is very likely to prescribe a balanced or combined estrogen progesterone oral contraceptive, right? And other than that, because obesity is also a component of this syndrome, right? So
Okay.
it's very important for them to eat right, eat healthy, and keep their weight under check. So those things would have additional benefit, right? Maintain active lifestyle, right?
So, in a way, we can say that having a healthy lifestyle can definitely prevent one from suffering from PCOD as well as in adverse cases from endometrial cancers.
Right.
So, thank you so much, Dr. Jyoti. It was really an insightful session and so much to learn from. Being a girl, I myself think that I have learned quite a lot of new things today, and I definitely need to keep a check on everything about the reproductive system, a system which comes with so much of complexities, I'll say. And thank you so much for sharing these useful insights with us today. It was a great pleasure to connect with you, Dr. Jyoti, today, and we really hope that your insights will help us in fighting the cancer and will motivate the young girls and the generations to adopt a healthy lifestyle. Thank you so much, Dr. Jyoti, for joining in us today.
Thank you, Dr. Ruchika. And thank you for having me over today. Thank you.
Thank you so much.